I've heard from doctors and nurses and even seen it in medical offices that many healthcare providers use a lot of different vendor softwares to get their clinical and e-prescribing done, and then another software vendor to complete the billing portion. Many work off paper still and have paper charts or spreadsheets to manage. So it sounds like you may have mastered that.
Well, we're certainly trying. So, but yeah, we've used AZZLY as our record, our EMR, and it's been great for us. Their platform is a cloud-based system. We're able to log in anywhere that we go. They have a lot of nice features that enable us to communicate easily between us. They have the telehealth portions built into the record as well. You definitely have to have a record that's going to work for you in the setting that you're doing it for, or it becomes a huge headache. If we were doing a paper right now, we would be in big trouble. The amount of it just wouldn't be feasible to do it really telehealth with paper. Believe it or not, there are organizations that are still using paper, and the amount of trees they're probably taking down, I couldn't believe. But either way, and it also has to be, have the features you need clinically, and it's also got to be budget friendly, especially when you're starting up. That's part of the reason why we chose AZZLY as our record, is because it was those things. It had the clinical that we needed for mental health and addiction, and then financially it was budget friendly for what we needed to start off with. Some of the records are quite expensive to really start off. People all want everything in a record, but then when they start really looking at it, you're like, oh my goodness, the cost is astronomical to get all that, especially, if you're a small business. It can be definitely cost prohibitive for that. And it has all the e-prescribing features that we absolutely need in there that comes through to make this viable.